Now to the COVID-19 pandemic. President Biden has ordered flags at federal buildings to fly at half-staff, marking 1 million COVID-19 related deaths in the U.S. On Capitol Hill, Congress held a moment of silence for the lives lost because of COVID-19. And as cases rise across the country, a White House COVID-19 coordinator, Dr. Ashish Jha, is warning that the virus still poses a risk.
We know that over time, immunity protection against the virus wanes naturally. That combination means that as we get to the fall, we are all going to have a lot more vulnerability to a virus that has a lot more immune escape than it even does today, and certainly than it did 6 months ago.
Dr. Jha and President Biden are urging Congress to approve funding for more vaccines and more tests. So joining me now is Dr. Celine Gounder. She is an infectious disease specialist and epidemiologist, and she is also the editor-at-large for public health at Kaiser Health News. Thanks so much for joining us on this really sort of grim milestone that I think at the beginning of this pandemic, I remember when they said 200,000 deaths, I was like, get out of here. No idea it would go this far. And now, the White House has said, listen, if we don't do something, we're probably going to see 100 million new COVID cases by the fall. What's your reaction to that?
100 million, so that's essentially a third of Americans. That's really on par with what we saw with the Omicron wave over the winter holidays. Mm-hmm. And what's really scary is that we are running out of funding. We are running out of funding to buy vaccines, to buy tests, to buy a drug. With respect to testing, a couple of the domestic manufacturers are already planning to lay off staff, and we're going to find ourselves in exactly the same situation as last year. This is this testing Hunger Games redux because we're not making our own tests.
It's so funny you would say that because at one point I had all these tests at home and I felt like I could take a test if I'm going over to a friend's house, take a test. And now I started to think, ooh, I should, maybe hold on to these for occasions that are really valuable to me that I need to go and I think that maybe there are older people there or something like that. 66% of the U.S. population is now fully vaccinated. And I just read, a report that talked about the fact that the people who aren't vaccinated, the percentage of people who are anti-vaccine basically hasn't changed in the whole 2 years. So I want to ask you, I know we stopped talking about herd immunity. Is that concept even, a possibility at this point when we've got some sort of a hardcore group that no matter how many vaccines we make available, they're not interested?
This concept of herd immunity also doesn't really apply to COVID in particular. It is just too infectious of a virus, has too short of an incubation period. People do get reinfected. The key is to protect folks against hospitalization and death, and you really do get very effective protection from the vaccine. So that's why we want to get that additional third vaccinated, is to really prevent another hospital surge and death surge.
Right. That makes a lot of sense. So speaking of sort of trying to manage this virus and getting on with life, a lot of people are heading out for their summer holidays. They're planning right now. They've been cooped up. Do you have any sort of advice, precautions that people should take? Mask mandates on public transportation have dropped. You still can wear a mask if you want to, but you're not required to. So what do you tell people as they're planning their holidays?
Well, just because you're not required to wear a mask doesn't mean you can't. You absolutely should if you have one at your disposal. I would highly recommend either an N95 mask or a KN95 mask when you're traveling, when you're in the airport, in common spaces. The last thing you want to do is get sick when you're on vacation. And if you are traveling overseas, see what the regulations are for when you return.
Yes.
If you come down with COVID, you may not be able to catch the flight back.
Yes, I learned that the hard way. Not that we got COVID, but we were on our way back home from vacation and then realized, we need a test to get back. And that was just as the mask mandate was dropping. And I just sort of kind of almost assumed that to get back on an American flight going to the U.S., you wouldn't need to test, and we did. Luckily, we were all safe and we're all good. Dr. Celine Gounder, thank you so much.